Good afternoon. My name is Yasmina Sisrak, and I'm your host for today's webinar. Thank you for joining us for our COVID-19 webinar series presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council and collaboration with Aspire Community Services in Illinois. We have added a summer webinar series to provide a space for community providers to share their experiences in maintaining services for people with intellectual and developmental disabilities during the COVID-19 pandemic. Things are rapidly changing, so we're really trying to adapt our webinars as things just change. These webinars will be recorded and archived. You will be emailed once the webinar has been archived. During the webinar, please note your questions in the chat box or question and answer box, and we will ask these questions during the last 15 minutes of the webinars. So for today's presentation, Protecting Ourselves, Protecting Others, Part 2, Caring for Someone Infected with COVID-19 in their home, we are very happy to have Melissa Desroches joining us again. Melissa is a registered nurse and post-doctoral research fellow at Tufts University. Melissa is a developmental disabilities nursing researcher and educator and a former critical care and perioperative nurse. The mission of her program of research is to improve the health, wellness, and quality of life of adults with developmental disabilities by improving developmental disability nursing care. For today, this presentation will examine best practices for higher level protection needs while caring for someone who has had a close contact exposure or has tested positive for COVID-19. Use of personal protective equipment such as face shields, gowns, and face masks such as N95 surgical masks and do-it-yourself face mask will be discussed, along with protocol for home care when someone tests positive. And finally, consideration for providers in any setting will be reviewed. Again, please ask your questions in the text box. I will mute, everyone is muted except Melissa, as she is the one presenting. And thank you again for joining us. Melissa, I will pass the presentation to you.
Thank you, Yasmina, and thank you for inviting me again to speak today for this Part 2 in Protecting Ourselves, Protecting Others webinar event. If you did not have a chance to listen to Part 1, please do take the time. You can find it on YouTube because much of what we will speak about today builds on the basics of using personal protective equipment and the basics of infection control, which was discussed last week. So I encourage you to view that webinar if you have not already. So as Yasmina mentioned, during this presentation, we're going to review a little bit of what we talked about last week, key points about COVID-19 and how it spreads. We're going to discuss some survey results about caring for a person with developmental disabilities in their home. We're going to review recent CDC guidelines for the care of persons with COVID-19 in their home, discussing best practices in hygiene and personal protective equipment, and identifying coping strategies to assist with routine challenges faced when caring for somebody with developmental disabilities in their home. So a brief disclaimer, all of this information is publicly available, and there is a references handout, or a resources handout rather, and I encourage you to go through all of the resources provided because there are many and they give great detail beyond what is presented in this webinar. So I encourage you to look at that. Everything here is for educational purpose only, and please don't use this as medical or legal counsel. Overall, it's informational. Be sure to follow your own state and organizational policies and procedures because things are always changing with COVID-19. We see new things every day. New studies are coming out. So just to review some key points about COVID-19. If you haven't heard already, COVID-19 is a virus that is new to humans. It usually commonly causes fever, cough, and shortness of breath. However, there are some individuals who are asymptomatic and they may never develop symptoms. There are others for whom a fever is not their usual symptom. So maybe they won't develop fever at all, but they'll develop a cough and some shortness of breath. And this is important in the care of people with developmental disabilities, especially those who are older or have immunosuppression, which means their immune system is down, or they're taking certain medications. People with developmental disabilities are often taking many medications. So that fever might not be present. So it's important to act with caution when we're looking at symptoms. And just because somebody doesn't have a fever doesn't mean they may not be displaying symptoms of COVID. Most people develop a mild case of COVID-19. About 80% of those who have COVID have a mild case. Again, some people have no symptoms, and symptoms usually begin about 2 to 14 days after contact. And in average, it's about 5 days usually. That's the mean time that it takes from exposure to developing symptoms. So this is just a brief overview, and I refer you back to that first presentation, the first half of the webinar, to get some more in-depth knowledge. But what is very important to know about COVID-19 is how it's spread, because how COVID-19 is transmitted determines what kind of protection we use for ourselves when we're caring for somebody with COVID-19. So COVID-19 is spread person to person between people who are in close contact. And the research studies show kind of a varying length of distance of spread, anywhere between 6 feet, even up to 12 or 13 feet. However, the main way is through respiratory droplets. So when an infected person coughs, sneezes, or talks in those little saliva droplets that you can't see, the virus is carried through the air. And when those droplets land in the nose or the mouth of a person who is within that 12-foot range, we'll say, they land, and that is how the infection gets in, when it lands in the nose or the mouth. And again, it's important that an infected person may not show symptoms, but they can still spread COVID-19 through talking, coughing, sneezing. In addition, possibly, if these droplets have landed on surfaces and another person touches that surface, that they can then touch their nose, their mouth, or their eyes, and they can become infected that way. That is not the primary mechanism of spread by touching surfaces. It's really the particles, the virus particles in the air. I know this is a repeat from last week, but it's very important to understand what type of protection we use caring for somebody in the home related to spread. So as I mentioned last week as well, with the Developmental Disability Nurses Association and my colleagues Sarah, Kathleen, and Judy, we have recently conducted a research study looking at challenges to meeting the needs of people with developmental disabilities related to COVID-19. And one of the major things that came out from our data is that there is just not enough support for community providers, for direct care staff. What direct care staff are being asked to do is basically in line with nursing and nursing assistant, providing isolation precautions and transmission-based precautions. And these are all things that you learn in a training course to be a nurse or a nurse's aide. And these aren't things that are generally part of the practice of a direct care provider. And as a result, there's not a lot of understanding. It's not easily understood. And when we don't understand something, in general, it leads to a lot of fear. So there is a lot of fear that's coming about from not having the proper understanding and confidence that what we're doing to prevent spread is actually going to work. So what can we do about this? That's what today is all about. Recently, the Centers for Disease Control and Prevention, I believe it was May 27th, released guidance related to caring for people with DD who have tested positive in their homes. And that actually included, they specifically addressed the role of direct care providers. So that's very important because for months we didn't have any specific guidance to this setting. We had long-term care, we had home care, but nothing that really got at the unique needs of people with DD. In addition, we're going to talk again today about how we use personal protective equipment specifically for transmission-based precautions, which basically means to prevent being exposed to some COVID-19 virus by using certain types of PPE based on how COVID is spread. And in addition, we'll discuss strategies to help with these changes to routine and stress that people with DD are hugely experiencing right now by being asked either to stay in their homes or their rooms, the whole social distancing bit. So the CDC guidance for direct service providers is mainly what I'll be discussing today because it is new. And the first step always is if you suspect that somebody in your care has symptoms of COVID-19, the very first thing you need to do is determine if emergency care is needed. You always want to err on the side of cautiousness. So call a healthcare provider or a hospital right away if you see any of the following symptoms. And you'll see they've even changed from the first half of this webinar. They've added new symptoms. So trouble breathing, constant pain or pressure in your chest, bluish lips or face, which indicates lack of oxygen, inability to wake or stay awake, and new confusion. So I did mention last week some changes in level of consciousness, and this has been added now because it's really difficult to be able to understand what's going on when somebody is not able to stay awake. This is a huge problem, and it reflects the fact that there's probably something else going on. And again, this list is not all-inclusive. If you see a change, a large change in the individual or even a subtle change in the individual that you support, we know that people with developmental disabilities often do not use verbal language, and the way that things are expressed can be different. So again, always err on the side of cautiousness, but these are your main markers for something is up related to COVID. If it's not an emergency and you suspect that the person may have COVID-19, but you don't feel it's emergent, at that point, you want to begin isolation. You want to keep this individual away from others as much as you can. And that includes yourself. You want to protect yourself and protect others. And we'll talk a bit more about isolation in the upcoming slides. You can also use, and the CDC requests that before you contact your provider or their provider, you use a COVID-19 self-assessment tool. And I've used this before when my father had symptoms of COVID and ultimately tested positive, and it's very simple to use. You log on to one of two COVID tools, and they're both in the references handout, and it will walk you through with basic questions. They'll ask you about different symptoms that you're having. If you've been in close contact with someone who's been diagnosed with COVID, if you live in a community where there's a lot of COVID activity, it'll ask about any medical conditions that put you at high risk for complications for COVID. It's important to note, again, older adults and people of any age with serious underlying medical conditions are at higher risk for developing more serious illness from COVID-19. I'm not sure if you follow the daily news anymore because it can be very disheartening, but on NPR, I believe it was today, Joseph Shapiro released some information today. I'm not sure if it was an article or a radio, but it's on the internet, and it shows the data for New York and for Pennsylvania, and the rates of death from COVID-19 are much higher among the DD population than the general population, almost doubly as higher in some cases. So please keep that in the back of your mind as well. If the person that you support is at a higher risk of severe illness, I'm not sure that I would go through the whole symptom checker. I would probably cut straight to calling the provider. We can also, for those who have the ability, we can encourage the client to contact their healthcare provider once we've gone through the symptom checker and help them contact their provider if assistance is needed. There is a big move now towards telehealth, and that is not only to protect the provider from bringing COVID-19 into the setting where there may be healthy patients, but also from protecting the individuals that we serve from exposure. If they're not COVID positive, and now we've brought them into a setting where there's been a lot of people with COVID, it can just basically a big petri dish, doctor's offices. So we're trying to keep people with COVID-19 out of the outpatient healthcare setting. So as a result, we're seeing a great increase in use of telehealth. And telehealth basically means there's two-way communication between the client and the provider. And we see many different apps being used now. The telephone counts, but Zoom, Skype, FaceTime, Facebook Messenger, Google Hangouts. You may need to help the client you support use the different software or different apps. There are some that are not allowed, and it's basically where the public can gain access to that call, like Facebook, TikTok. I don't even know what Twitch is, but it's on the not allowed list. Federal agencies have added flexibility and loosened restrictions on the use of telehealth during this pandemic, and that includes people covered by Medicare and Medicaid. So this used to be something if you had certain kinds of insurance that may be covered, but they've really loosened the restrictions on this to be able to protect people from exposure to COVID. And right now, you can also use telehealth to get in contact with the doctor or the healthcare provider for issues that are not related to COVID as well. And that's just, again, to protect against exposure from coming into the healthcare setting unnecessarily. Some things you'll still need to see a provider face-to-face for. If they need to, look inside your ears, or if they need to feel something or palpate something, they may ask you to come in. So prior to contacting the doctor, it is a good idea to write down what to tell the doctor ahead of time, what to tell the healthcare provider. Often this may be a nurse practitioner or a physician's assistant as well. So you can write down the symptoms that the person's experiencing. What are they, as well as when did they start? Any other health conditions that the person has, and how they've been able to be taken care of during the pandemic. Have there been challenges getting certain medications? Have there been challenges getting medication supplies? Because not taking medications, as we know, can lead to other health problems. So this is important to include as well. Exposure to COVID-19. If you've definitely been exposed to somebody, how were you exposed and when? And we'll talk a little bit more about exposure in upcoming slides. And then write down your questions. It's so easy to forget when we're on the phone and we're distracted. They may be asking us questions. Write down the questions that you need answered. Now, the ARC of Massachusetts, the state that I am from, recommends asking the provider for a letter stating what reasonable accommodations are needed in case the person needs to be hospitalized. And I think this is a fantastic idea. We know that people with developmental disabilities face challenges in the hospital setting. They're at increased risk for complications. And we can advocate by asking for care that's been adjusted based on the needs of the person with DD. And that idea is called reasonable accommodations, and it's mandated by law according to several disability laws, including the Americans with Disabilities Act. So when we make adjustments to how things are usually done to make sure that healthcare services are fully accessible and available to people with disabilities, we're making reasonable accommodations. And some of these things that we should be asking for, number one, most important, is allowing a support person in the hospital. And it's not the same thing as asking to have a visitor. This is a support person that's helping the person cope with the hospitalization. It may reduce challenging behaviors. This may be to help the person communicate. So this is primarily the most important thing to ask for. And you can ask the provider to have this written into a letter so that if the person does need to go to the hospital, you have that a signed letter from their primary care physician that states that this is a necessary, reasonable accommodation to provide care. Other reasonable accommodations include the use of an interpreter for sign language or some type of communication device, needing a quiet area or having procedures that are earlier in the day. Maybe the person has pica or doesn't understand why they can't eat, and getting into food may be a problem. So these are reasonable accommodations, basic changes that we can request healthcare settings make, and they go a lot further when you have a letter from your provider. You do not have to have a signed letter from a provider to request reasonable accommodations. You can request them to any healthcare provider in any setting, But given the nature of how overburdened the hospital systems can be with COVID-19, anything extra to get the attention needed is recommended during this time. Okay, so that's the piece about hospitalization. We remember that 80% of cases are mild, and hospitalization will not be recommended. So if hospitalization is not recommended, we're going to assist the client to practice home care recommendations related to COVID-19, which we will talk about in subsequent slides. We're also going to follow healthcare provider guidance for standard and transmission-based precautions. Now, this is very important because you can see we're looking at the CDC guidelines for direct service providers, and the guidelines are telling us to follow healthcare provider guidance. The CDC guidelines can be very confusing. If you go on, there are pages and pages and pages of guidelines, and they will tell you to do different things if you are caring for someone with COVID-19 in their home and you're not a healthcare provider or a direct service provider. So they're recognizing here that DSPs really are doing the job of healthcare providers. So you follow healthcare provider guidance and you use healthcare provider grade PPE, personal protective equipment, to protect yourself and the person you serve from transmitting COVID-19. So an important takeaway piece from this is that if you are caring for somebody who is suspected or confirmed to have COVID-19, cloth face coverings are not okay. In the home setting, if you're not a direct care provider and you're a family member, they may recommend use of cloth face coverings. But as a professional, as a direct service provider, if the person that you are supporting is suspected or positive of COVID-19, cloth face coverings are not appropriate. You need healthcare provider strength PPE, which we'll talk about. We should be encouraging clients, if possible, and I understand this is a huge limitation for many, but if possible, to wear a face mask or some type of cloth mask, a bandana, as tolerated if they don't have a respiratory condition that this is going to pose a problem for, or a behavioral condition that they're not going to be able to understand, and it's going to be a huge challenge. In addition, if hospitalization isn't recommended, you want to connect with your local disability department, so state level here in Massachusetts, it's DDS, or your council. And there are resources on the ACL website as well, the Administration for Community Living website. You'll also want to, as a healthcare provider, call your healthcare provider about your own health. There may be a chance that you were exposed, and you would know this based on the last time that you worked with the person, and your healthcare provider will talk to you about that as well. So it's important you contact your healthcare provider. You'll also be part of a team that's determining if home care is the right strategy for this person who's now tested positive for COVID-19. And this is one of the biggest challenges that has come out of our DDNA nursing survey, is that determining how ever are we going to isolate people with developmental disabilities to their rooms, and how are we going to do this? How are we going to implement isolation? So we'd be working together as direct care staff, as nursing, with the healthcare team. And these are some questions we have to determine if home care is going to work. Are there appropriate caregivers available at the home? We know that not all people with DD are living in 24/7 residential settings. There are people who live in shared living. There are people who live in foster care. We know many different settings. People are living with family who may be out working during the day. Are there appropriate caregivers available at home? Is there a separate bedroom where the client can recover? This is important because we don't want to expose anybody that may have not yet been exposed. Having a separate bedroom is hugely important. Are there resources to be able to access food and other necessities? Are there people who can help bring in medication and supplies? Are the client and other household members capable of adhering to precautions and isolation? Again, this is the major challenge that we're seeing. And are there household members who may be at increased risk of complications from COVID-19 infection? And again, this is also a challenge, as we know that many people with DD have many chronic conditions, more so than the general population, so this can also be challenging. There's really no hard or fast rule about how to isolate and quarantine people with DD nationwide. We have recommendations. That's why we anticipate and we recommend that you contact your local resources. Reach out to your Department of Developmental Services or State Disability Council and the Department of Public Health. In some settings, I've seen that people have shifted residences so that there is a home, if it's a residential setting that's devoted to care and rehabilitation of people with COVID-19. We've seen that some have used motels for kind of an interim COVID unit, or to shift others who tested or who were not positive and the others in the home were positive. We've also seen some discharge policies that make it very, very difficult to quarantine or isolate, or rather they mandate that you quarantine or isolate as soon as you've been in contact with the hospital. Even if you were tested negative, they assume that you're exposed, and so you can't be around others for 14 days. So it's very important that you're aware of the resources and you reach out to your state DD provider as well as the Department of Public Health, because they'll help you to be able to guide you towards the correct strategy if home care is not the correct strategy. Okay, so time out. What if home care is not the right strategy? This is basically what we just talked about. In some areas, again, there's a 14-day quarantine required after hospitalizations. Following the agency's pandemic plan is important, because perhaps this has been, and hopefully this has been anticipated ahead of time as to what the strategy will be. And there's a really great example that New York State put together for adult care facilities. And it's a very in-depth, thorough pandemic plan. And you can see that in the references, the resources handout. It's also on the American Academy of Developmental Medicine and Dentistry website. They have a great resource section. Again, contact the state disability councils. And again, it's important that I really don't have a hard and fast rule to give you. It's based on individual circumstances. So looking at the needs of the individuals, the specific needs of individuals in their homes, as well as the care providers, chronic conditions. Again, there's many different ways to approach this. So back to home care recommendations. So we mentioned DSPs are recommended to follow home care recommendations as well as transmission-based precautions. So here is the piece about home care recommendations. We want to provide support for the individuals and the persons with DD to help cover basic needs. So making sure that we're meeting those care needs, including taking over-the-counter medications like Tylenol and fever reducers, encouraging fluids and rest. That's very important. Pneumonia is a common condition that develops based on COVID-19. So making sure that the person is hydrated enough so that the mucus isn't too thick. And symptoms usually resolve in about a week. So it's about a week of TLC. It's important, again, to watch for emergency warning signs during that time frame. If you see any warning signs or anything that you are suspicious of, call the medical provider right away. And it's important to let the dispatcher know that the person has or might have COVID-19, because they will take protections to protect the team to make sure that COVID-19 is not transmitted to the first responders. At this point also, again, home care recommendations involve limiting contact. So the caregiver, if you're the caregiver, you should not be someone who is high risk for severe illness from COVID-19. You should not be asked to care for somebody who is suspected or positive if you are at high risk. Last week, we discussed a list of high-risk conditions, so please refer to that. But if it's diabetes, a chronic lung condition, if you're immunocompromised or taking immunosuppressants, There is a list. Please refer to the list. In addition, you'll want to have the person use, again, a separate bedroom, but also a separate bathroom if possible. If there's 2 bathrooms in the home, dedicate 1 bathroom for that person, which can be challenging if you have a home with 4, 5, 6 people in it, but that's important to reduce the spread. You want to try as best as you can to stay 6 feet away from the sick person when possible. So putting down their meal and then moving away, however that you can make this work when possible. If there is shared space, hallways, any areas that there are going to be people with COVID and without COVID in some common area at some time, it's important that the area is well ventilated. So opening a window, running a fan, that's going to help circulate the air and move it along and through so that the germ, the virus is not staying in the air in one place. As well as avoiding unnecessary visitors. So here you really need to look in the context of the people who are living in the home and what constitutes unnecessary. There are some for whom certain therapies are going to be necessary and very important. There are others for whom maybe certain therapies could be put off for a few weeks until the COVID quarantine period or isolation period has passed. This includes family members and friends as well, which does make it very, very difficult. Okay. In addition, other home care recommendations: eat in separate rooms or areas. This is especially important with people with DD. We know that there is a high co-occurrence of swallowing difficulties, dysphagia, and when we have difficulty swallowing, it can cause us to cough. So mealtime can be one of those times when it's exceedingly important to separate people who have COVID and who do not have COVID or are suspected to have COVID. Any time that you're handling any dishes, glasses, silverware, anything that the person has come in contact with, if their saliva has come in contact with, you want to use gloves and wash these items in hot water with soap or use a dishwasher. Dishwashers actually do a better job because the water temperature is much higher. And wash your hands after removing the gloves. Also, kind of basic, but avoid sharing personal items. So think of things that are frequently touched in the home, and those things for a person who has COVID, you want to have a completely separate set of those things. So we don't want to use the same dishes. Even though we've washed them in the dishwasher at high temperature, we want to have a separate set of dishware, silverware, towels, bedding, commonly touched items, electronics, a separate set for the person who is sick. It just helps to reduce the risk that there's some virus particles left over that could then be passed on. Cleaning hands often. I think we've heard this over and over again, but it's very important that you do a thorough job. Right now is not the time if you're a woman, not that you even could, I was going to say go out and get your fingernails done. They are starting to open things, but you want to keep those nails right now as short as possible. You don't want any COVID-19 getting in the nooks and crannies. You really want to lather up, wash at least 20 seconds, getting all surfaces in between the fingers. If you do not have access to soap and water in a given situation, alcohol-based hand sanitizer is fine as long as it has 60% alcohol or greater. And you need to make sure your hands, your fingernails underneath have been thoroughly wet, not just a little bit and rub in the center of your palms, but you've gotten your hands as wet as you would be if you were washing your hands. And again, you can refer to last week for the in-depth discussion of hand washing. You're going to want to also clean and then disinfect high-touch household surfaces daily. So there is a difference between cleaning and disinfecting. So cleaning uses some type of soap or soap and water, and the idea is that you're washing off soiled material. You're washing off the germs. Same as when we wash our hands. We're washing the germs off down the sink, down the drain. Then we're disinfecting. Disinfecting is actually killing the germs on contact. and you'll need to use an EPA-registered disinfectant, which we'll talk about on the next slide. But basically, it's been researched to show how long each product needs to sit on the surface to kill germs. And so if it's registered with the EPA, we have that science and we have that understanding of what we need to do to make sure that product kills the germs. You want to follow the instructions on the label and pay attention to how long the product has to be wet on the surface. If you've just done a late mist and 30 seconds later the surface isn't wet anymore, you haven't killed the germs. You'll need to wear personal protective equipment according to the recommendations of the label for the cleaning agent, and it's important to use in a well-ventilated area. Some of these chemicals, they can be irritants. They can cause coughing, mild asthma symptoms if you're using them in an enclosed area. Now, this is a recommendation, number 8, that seems to be, at first glance, counterintuitive. So the recommendation is to clean the area around the person that's infected only when needed. The idea is that we're limiting our own exposure to the COVID-19 germ by only cleaning the area when needed. We can supervise if the person is able, cognitively and physically, we can supervise them to clean their own area. They can have their own dedicated cleaning supplies and personal protective equipment, and they can clean their own area. This is also recommended for the bathroom. Of course, it's going to be up to how the person feels as well. If they're very ill with COVID-19, they're not going to be feeling up to cleaning their shared bathroom space. But in later stages, when the person maybe is feeling well, but is still under isolation, that we can help prompt with the cleaning. So again, it's important, unless the area is visibly soiled, we're not going in every 2 hours to wipe down somebody's immediate area. Okay, that's going to increase our exposure. If the person is using a shared bathroom, the caregiver should wait as long as possible before going in to clean and disinfect. Again, we know that COVID-19 can live on surfaces, and so the longer that we wait, the idea is after, if we can even wait a couple hours, that it's less likely that we have germ particles, or we have fewer germ particles remaining on surfaces. Some surfaces, the germs live longer than others. In addition, however, germs do begin to die right after contact, so the total number would be less the longer that we wait. So here is just a brief timeout about choosing and using a disinfectant. On your resource handout is a link to the EPA website for choosing your cleaning product, and you can scroll through the list. You can look up by EPA registration number, and you'll see the product name. So there are hundreds, actually, but I've just taken a screenshot of a bleach section here. And you'll see even just within bleach, different bleach products have different contact times, different times that they need to, the product needs to remain in place for the germs to be killed. And so it'll tell you, it says to kill SARS-CoV-2, COVID-19, it tells you to follow the directions for the following viruses. And so you'll see there's different viruses that are listed. And that's because when these products were made, we didn't have COVID-19 yet in humans. So COVID-19 is not on the label. There's not directions to kill COVID-19 on the label. So the EPA website is telling you to follow the directions to kill this particular germ or that particular virus, and that will be your instructions for use. So on these bottles, you may have different instructions to kill different types of viruses. You want to follow the instructions that listed on this EPA website for that particular cleaner. Okay, so back to home care recommendations. You'll want to use a separate trash receptacle for the sick person, and it should be lined. Make sure there's a garbage bag in there is basically what it means. You want to make sure that you're wearing gloves when you're removing the garbage bag from the garbage pail, and anytime you're handling or disposing of trash, and then wash your hands afterwards. It's important that others can't get into this garbage pail, because it's where you're going to be putting or prompting the individual to put all of their dirty tissues or their napkins, everything with their cough secretions on it. So we want this away from people in the home that could get into this. And again, wear gloves, wash your hands after you remove your gloves. You always need to wash your hands after you remove your gloves because you can contaminate yourself when you're removing gloves. As far as laundry goes, you want to use caution with dirty laundry because we know that this germ can live on surfaces for a short period of time, and anytime things are moist and dark and warm, germs tend to live longer, and laundry is one of those places where things can be moist. So you want to wear gloves when you are working with dirty laundry, and don't shake out the laundry. We say this in the hospital when we're working with sheets. The same thing goes when somebody is in bed and you're fluffing their sheets. You don't want to shake out anything that's been around the person because you can be releasing those virus particles into the air. So don't shake out the dirty laundry. You do not have to do laundry separately for a COVID-infected person and a non-infected person. You can wash the laundry together. You want to use the warmest water allowable and the hottest dry cycle possible, but you can do the laundry together. Okay, so the second recommendation for direct support staff was to use transmission-based precautions just like a healthcare provider would. And what transmission-based precautions means, again, is that we are using personal protective equipment based on how a particular germ is transmitted. So in this case, the particular germ is COVID-19, and we know that it's transmitted by respiratory droplets that linger in the air for up to about 3 hours. So a mix of droplet and airborne precautions. We use standard precautions, which basically means that we protect ourselves, assuming that anything that the person comes in contact with is infected. And we're also going to use an N95 respirator or a healthcare provider face mask if we do not have access to N95s. An N95 is that round face mask that's firmer, and there are photos in part 1 of this presentation that fits very snugly to the face to make sure that there's a seal, and it filters out 95% of virus particles. A face mask is, again, healthcare provider strength. It's white on one side, blue on the other, and it provides more protection than a cloth face covering. So you want to use healthcare strength personal protective equipment. You will want to use a face shield or goggles to protect your eyes because your eyes and your face are a route where COVID-19 can enter. You will need to wear a gown, something to protect your clothing. And oftentimes these are disposable gowns, but reusable gowns are okay as well. They'll need to be laundered after each wear, as well as gloves. The gloves do not need to be sterile. We're not worried about introducing germs. We are worried about getting them, so they don't need to be sterile gloves. We need to put all of this on before we're entering the client's area. We need to wear it the entire time and wear it correctly, which means we're not touching our faces, we're not touching anything, we're not adjusting our PPE, or retying the gown, anything like that. And then when we come out of the patient's area, we are removing this PPE slowly and in a deliberate manner to make sure that we're not contaminating ourselves while it's coming off. And in part 1, we talk all about the order that we put on PPE and take off PPE, which is very important. And I don't have time to go through that now, so I recommend, if you haven't seen it already, refer to part 1. Something else that's extremely important to talk about today is helping people with DD through routine changes. There is quite a bit of material out there, and next week the webinar in this series is about resources for people with DD to help understand what's going on. But you can use visuals and social stories, some of this existing material to help explain these changes. Allow extra time in the schedule to accommodate changes. So you think it's going to take you a half an hour to get ready to do whatever it is that you think you need to do, get out of the house, whatever it is. allow yourself extra time to accommodate some of these changes. You can use the behavioral supports that we've been using for other things, the tables, the charts, the clocks, anything to help explain the new schedule, and start, if possible, with small changes. I know many people now have been isolated, quarantined, social distance for so long now that maybe it's beyond small changes, but small changes to start and reward flexibility. Remember what we know about positive behavior supports. When we reward the good, we tend to see it again. As well as it's recommended to create a calming down or decompression routine when this stress is becoming apparent. There is some recommendations here. There's a good days and bad days during lockdown resource that talks about the importance of some key things that we already know. We know it's important to be active and healthy, but we've found in our data through the DDNA survey that healthy diets are being neglected right now. Physical activity is being put to the wayside, but these things are really important, not just for our overall health, but for our mental health. And mental health and behavioral health are a huge challenge right now during COVID-19. So things like enjoying our friends, even if we're connecting with them with Zoom over telephone, but making a conscious effort to connect. Ordinary things like what we like to do, choice we know is important. If we can find some new thing to do, something interesting to get lost in, that's important. So you can check out these resources. They're very helpful and directed specifically for people with DD. CDC also releases guidance for group homes for individuals with disabilities, where it specifically talks about managing stress and anxiety because this is such a problem. Providing accessible information, again, and there are some in the resources handout. Looking for changes in sleep, eating, and mood as indicators of needing help with adapting to changes and processing emotions or implementing wellness strategies. We know oftentimes, again, the individuals that we support may not use verbal communication, or they may have limited cognitive ability to be able to process how they're feeling about all of this. And so looking at subtle cues, is the person sleeping a lot more? Are they awake half the night? Are they eating a lot more or a lot less? Are they short and snippy lately when they're usually easygoing? So these are as well, and I see another webinar popping up here that we have a webinar on this topic, so that's wonderful. In addition, we want to develop ways and really put an effort into helping people with DD maintain their social connections. That goes for everybody, but as well as for people with DD, trying to maintain routines as much as possible. And again, incorporating wellness activities, ways to get moving. Even if you're looking at new healthy recipes together, something to just keep wellness in the forefront of our minds. And if we are doing group-based activities, even in the home, we want to remember to social distance, the 6 to 12 feet apart if we can, and try not to do things that use the same equipment, like bouncing a ball, things where people are going to touch the same equipment. And we should have, if the person is, again, COVID positive, they're not going to be participating in these group wellness activities. But if there are others that are not COVID positive, encouraging everybody to wear cloth face coverings is important. So when do we discontinue isolation precautions? Because that's something we all want to know. It's specific based on your healthcare provider. Because some people have conditions where it's harder to fight things off. They may be immunocompromised. So you always want to check with your healthcare provider first. But in general, if the person had COVID-19 and had symptoms, we can, in general, discontinue isolation as long as the person's had no fever for 3 days, their symptoms are improved, and they've been in isolation at least 10 days since their symptoms first appeared. So what that means is, in some cases, you're not going to be tested to find out if the person is negative. There's this way that, based on their symptoms and how long it's been, that then we recommend that isolation is discontinued. Sometimes, if there's testing available and the provider wants it, they will test to make sure that COVID-19 is gone, but you need 2 negative tests 24 hours apart. If the person tested positive and had no symptoms, perhaps this is a housemate of an infected person, it has to be at least 10 days since the person passed, 10 days that have passed since the test. But if they develop symptoms at any point, they go back up into that category 1, and then you discontinue symptoms based on no fever and that it's been 10 days. So transitioning from work to home. So for you as care providers, some recommendations. We briefly talked about them last week, but you want to bring only the essentials to work. Don't bring anything to work that you don't have to. Wear your hair pulled back if it's long. You want to bring a change of clothes and shoes to change into after work, and a washable bag that you can carry and launder them in. If you can find shoes that you can launder, go ahead and do it. Put it in a mesh bag. Wash them when you get home. As soon as you get in your vehicle, as soon as you change into your clothes, you want to use hand sanitizer and really wet all of your hands. Do a really good job. I sanitize my steering wheel. I sanitize like everything that I touch in my car. As soon as you arrive home, despite the fact that you've changed and you've sanitized, shower. As soon as you arrive home before touching anyone or anything. Now you've washed those germs down the drain. And then you want to wash and disinfect any items brought back and forth from work to home. My husband disinfects his lunch bag, or you can even leave your lunch bag in the garage if you want, and put your lunch in it every day, and you're never bringing the actual bag in and out of your house. You want to clean and disinfect your home regularly, at least once a day. You don't have to be crazy. You don't have to be obsessive about it, but at least once a day. And you may choose to isolate, if possible, from your family to limit their exposure if you're working with someone who's COVID positive. Some have done this. So you may choose to use a separate bedroom and bathroom until the person that you support is out of that time period for transmission. So what if you were exposed? So determining what is an exposure. So in order for something to count as an exposure, you need to have prolonged, which means more than 15 minutes, or any period of time where aerosol was generated, which means like germs were vaporized. So the only time you would really see this in the home setting is if somebody may have a trach and they're using a nebulizer, or somebody has a handheld nebulizer. That's considered an aerosol generating procedure. So if you were with somebody for any period of time that was using a nebulizer, or if you were with somebody in general for 15 minutes or more, and you were within 6 feet of them, and they tested positive for COVID-19, that's an exposure. Was this contact within 2 days before the person developed symptoms? This is currently, right now, the time frame. It's been decreased. It used to be a longer time frame. But the studies are showing that really it's just that 2-day time frame that now we're concerned with. If you were with them for 2 days before they developed symptoms. And were you wearing appropriate PPE? Were you wearing a respirator or a face mask and goggles? If that criteria, if the first 2 criteria are met and you weren't wearing appropriate PPE, then this is considered an exposure. If you've been exposed, you will be out of work for 14 days on home quarantine. In the event of staffing shortages, however, the CDC allows you to work if you have no fever and no symptoms. But you must wear a face mask that is not cloth, so a medical grade face mask, for 14 days. Optimal condition, you're out of work for 14 days. In the event of short staffing, you may be asked to work as long as you're not having symptoms, but wearing a medical grade face mask. So we hear a lot about the difference between isolation and quarantine. So what is the difference? Isolation separates people who are sick from people who are not sick. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they're going to become sick. So if you were exposed to somebody in the workplace and you're asked to stay home for 14 days, you're under quarantine. If you actually develop symptoms and you need to separate yourself from others, you're under isolation. Lastly, coping with stress. So for you yourself, it's important. Take care of yourself right now. It's a very stressful time. stress weighs on our bodies, it makes us more susceptible to illness. Take care of your body, eat healthfully, try to get some physical activity. A few minutes out in nature does wonders for your body. Make sure you're taking time to unwind and doing something that you enjoy. Getting away from watching or reading the news is very important. Not just COVID right now, there's so much going on that can weigh heavily on our hearts. Take a break from it. Connect with others, and it's okay to talk about how you're feeling. That's perfectly acceptable to do and encouraged. If you're feeling overwhelmed with sadness, depression, anxiety, thoughts of hurting or killing yourself, of course, call 911 if you're going to harm yourself or others. If it's not that extreme, there are helplines available and really are wanting to connect with you. We know that healthcare providers are experiencing stress unlike we've seen before, so please do use these resources if you're feeling not yourself. A huge thank you for all you are doing. You are the hands and hearts of DD Care, and you're not recognized. I'm glad the CDC has finally released guidelines that recognize DSPs as healthcare provider staff. That's a crucial first step. So thank you from the bottom of my heart for what you are doing.
Thank you so much, Melissa. I just wanted to repeat, we are recording everything. The PowerPoint and the resource list will be made available. We're posting it on our YouTube channel, and you will be emailed once everything is up. And it's usually, we try to get it as soon as possible within this week. Also, if you are on our HealthMatters listserv, I've already sent out the CDC guidelines for people with disabilities and DSPs, et cetera. So you already are getting some of those. And then I have already also posted a webinar that's, it's not our webinar, but we just passed it along, and it's strategies for addressing anxiety related to COVID, and it's on June 24th. And that has also been sent out. So I have been getting questions, and please feel free if you have any questions to put them in a chat box. So I'm going to start with the first one. So what about being in pools or lakes? Can COVID be transmitted that way?
The data is showing no. So in general, being swimming with others, this is not a concern for transmissibility.
Thanks. What is the best way to make a homemade cloth mask as protective to the wearer as possible if the person they are caring for is unable to wear a mask?
Sure. So last week in last week's webinar resources, there are instructions for making cloth masks. The idea is that we are creating them as snug to our face as possible, and not to mean tight, but basically so there's no gaping holes around. So I'd refer you to the resources for last week, and there's actually instructions for how to make a cloth mask.
Thank you. What health risks should be considered if a DSP has recovered from COVID and having them return to work with individuals who do not show any symptoms? Is there any current research on if someone can transmit COVID to others after they have recovered?
Right now, the research is not conclusive. What we know in general about other viruses in similar families is that usually once you've recovered, you are no longer considered able to transmit the virus. We don't have conclusive studies on that now, but in general, when people have recovered, we do have them go back to work, but we usually do have them use the same standard and transmission-based precautions because we do not have studies that show that you are 100% protected at this time.
Thank you. Would running a fan run the risk of spreading the virus particles around in common areas?
No, it's actually recommended to use a fan or a window, opening a window, to be able to just diffuse the virus particles and move them along. So per the CDC, it's recommended in common areas to run a fan or open a window.
My daughter was on a ventilator for 25 days with meconium aspiration as an infant. 23 years later, is she at risk for a more severe case of COVID than someone in her identical state who had not ever had compromised breathing?
I couldn't say. I'm not a medical provider, so that would be a discussion that she would need to have with her healthcare provider about her relative risks. It would depend on her recovery and her current lung function.
Thank you. Does a CPAP machine produce the droplets in the air?
That's a good question. I don't know off the top of my head, but I would suspect yes.
Okay. Keep the questions coming, please, if you have any. There was a request to add a couple of pages of to include donning and doffing of PPE to this presentation before we post it. I think I can do that. We can just copy paste it from your part one. All of that.
Yeah, that was in part one, and that's very important. That's a very important concept because you can completely contaminate yourself removing PPE that was put on perfectly and used perfectly. So please do refer to that webinar and to those resources.
And that webinar is already up. So yes, I can include a link to that webinar as well in the PowerPoint, so that way you will be able to have it. There was a question, will we do a webinar about school for developmentally disabled? I'm not sure. Can you be more specific what you mean by that? Is a pregnant provider considered high risk?
Yes.
Yes, okay. I will, I'm going to put the link to part one webinar right now, and I'm just going to find it. Keep questions coming, or do you have anything else to add while I'm waiting for the questions to come through?
I do not. I would just always highlight the fact that individual states have different policies, and the public health departments have different policies. So always checking with your local area, because ultimately sometimes risks in your community are different, and how things are handled are different within your community. So just making the most of what resources you have in your own area is very important.
Thank you. Here's another question. What about precautions to do at the adult day programs?
Currently, there are no recommendations specific to adult day programs, and that is something that we have seen in our ddNA nursing study that is concerning, and it's similar to the situation that we're seeing with schools, with day settings for children. The recommendations, if they are to look similar to what we're seeing in schools, can be things like limiting sizes to 10 at a time, and making sure that we're able to sanitize surfaces in between, and wearing masks. So I would anticipate that should we see guidance specific to day habilitation settings, it's going to look very different from day habilitation as we currently know it. But to my knowledge, there are currently no guidelines available for reopening of day habilitation settings.
Thank you. Does using a CPAP make one high risk?
Does using the CPAP make a person high risk? I think it would depend on the condition, and is it worn only at night? Is it used during the day? I think that that's a question you would have to have with your healthcare provider if it's you yourself. So I'm thinking some people use CPAP at night for sleep apnea, and would that make you high risk? I would have that conversation with your provider. I suspect it may.
Is there any info on van or bus practices? I'm assuming transporting individuals with intellectual disabilities.
I have not seen any recommendations in the CDC information related to that. I can say, again, it's probably going to look very different from what we have seen in terms of spacing, like the capacity of individuals. I've seen recommendations for school buses, and it's really a decrease in the number of people at a time. So this may be a challenge that we face, again, with reopening rehabilitation centers and how we're going to get people back and forth. But I haven't seen any guidelines specific to that.
What about dental appointments? Any danger there?
With dental appointments, dental, I believe, is going to be opening back up again, and it will be personal protective equipment will be the way to go for the dental providers. So it's more in terms of risk to the providers, I believe, than risk to the people visiting the dentist. But I haven't seen any specific guidelines related to people with DD and dental care at this time.
Are there recommendations for how many persons per square feet in a classroom?
So I have only seen, I'm really thinking, so the CDC has sent out recommendations for school reopening and what that would look like. And I've also seen in my state, Massachusetts recommendations. So I may be conflating them in my head, but the class sizes are much smaller. We honestly don't know what this is going to look like exactly in terms of school reopenings. This is something that each district is looking at individually, and many districts right now are putting together, I know my town is anyway, a task force on how to do reopening. There's thoughts that there may be some telecommunication like we're seeing now with limited in person. So everything is still very up in the air, and ultimately it's dependent upon the circumstances in the individual area. So in some cases, I don't think it'll be, or in most cases, I don't know that it'll so much be national guidelines, and same for day habs and transportation. I think that a lot of this will come down to working with your state level providers and DD councils, public health departments, because it will depend on the COVID activity in each community.
Thank you. If you're caring for a person that has COVID-19, since the cloth masks do not provide sufficient protection, does it have to be an N95 grade mask? No, that's optimal. An N95 grade mask is optimal in the care of a person who is positive for COVID-19, but there is a shortage, and the CDC does state if there's not an N95 available that healthcare provider surgical medical masks are the next indicated product, but not a cloth mask. Thank you. Any other questions? I know we're about 8 minutes over. I don't want to keep everyone. I wanted to again thank you, Melissa, for joining us and providing this amazing up-to-date information. Join us again next Tuesday, June 16th, for talking about COVID-19 resources for people with intellectual and developmental disabilities. I've posted the link to our registration in a chat box. I will also send it out through with the email that has all the information on this webinar and the resources and the recording available. Melissa and I are going to stick around for a few more minutes to see if there are any other questions. Other than that, thank you so much and have a great rest of the day. And thank you, Melissa, again.
Thank you.
Everyone is saying thank you, but I don't think there are any more questions. So
Oh, how should we go about disinfecting pillows that someone with COVID is using? Okay, so
I did not get that.
It just popped up here. So if they can be washed and dried, some pillows are launderable, and that's certainly fine. Just make sure they're washed in the warmest setting and they are dried at the highest temperature allotted. If they're not launderable, I would, after they are in use, you can leave things. So the germ's going to die on its own. If it were me, I would put something out in my garage. To be safe, I'd put it out there for a couple of weeks, and then you don't have to worry about that afterwards. Put it in your basement. Put it somewhere where there's access to air. It's not in a tight container, and it will not live. The length of time that something lives on surfaces is not all that long. So as long as it's been outside a good while, and by that, or not even outside, but away from anywhere where anyone's going to get it, the germ will die on its own.
We had a question about, can you repeat the stats on death rate for people with DD?
Sure. Actually, I have them listed over here. So it came off of NPR. I believe it was today with Joe Shapiro. In New York and Pennsylvania, COVID-19 case fatality rates for people with intellectual and developmental disabilities are higher than the state's overall rates. What a case fatality rate is the percentage of deaths as related to the total number of confirmed cases in the entire population. In New York, the case fatality rate for people with IDD is 16%. In the general population, the case fatality rate is 6%. Looking at that in Pennsylvania data, the case fatality rate is 14% for IDD, and for the general population is 8%. And I saw that Yasmina just posted the link, so you'll be able to have that data in front of you.
Yes, I just found it. So Katie, about the N95 mask. I don't think she heard your answer. If you're caring for a person that has COVID-19, since the cloth masks do not provide sufficient protection, does it have to be an N95 grade mask?
No, so there's something in between. So we have N95s, which are those like firmer, circular masks, and then you see the medical grade masks, which are, they're blue on one side, they're white on the other, they often tie. That is the next step down. So if there's no N95s, you should have access to healthcare provider strength, just regular masks that are not N95s.
Thank you. All right. No other questions that I can see. I don't know if you had any privately to you. Again, thank you all. Hopefully some of you will be joining us next Tuesday. And Melissa, thank you, and have a great rest of the day.
I see one more question. Can I address one more question?
Absolutely.
Not sure if this was mentioned, but if you have COVID, are you able to get it again? And should the person be worried after recovering being near another family member who develops symptoms? So there is no firm, hard, fast data that says that you cannot get it again. Based on what we know about viruses, the suspicion is that once you have it, you have immunity for some time. We don't know how long that time frame is yet. So that's something you'll want to discuss with your healthcare provider. They will probably have more access to current medical findings related to COVID-19 as that situation develops. But as of right now, from the science that I've seen, we don't have any hard data on that. Okay, I think that is the last question that I saw to me privately.
Yeah, I don't see any more. All right, thank you, everyone. Bye.
Thank you very much. Have a great afternoon.
Thank you. You too. Bye.